Hi, this is James at Cerritos Dental Implant Center. So we're going to answer another question that we get asked quite often is, do I need to get braces done before I place my implants? The answer to that question depends. So if a patient is in his early 20s or 30s and doing ortho would drastically improve their bite, then yes, we recommend doing ortho before having implants placed. However, if a patient is older, let's say in their 60s and 70s, then we probably would not recommend ortho treatment in those cases, because when you're 60s and 70s, ortho outcomes, they don't necessarily end up well. It's not a drastic improvement for most patients. In addition, ortho takes about 1 to 2 years to accomplish, so people in their 60s and 70s, they don't want to wait that long before they can place their implants. So it really depends. So the younger the patient is, we recommend basically doing ortho, because the straighter your teeth are, the better bite you're going to have. Having a better bite basically means the bite force for your mouth is evenly spread out. If that's the case, it takes a load off the implants, and implants will last longer. All your other natural teeth will last much longer too. So in short, if you're young, yes, we recommend ortho. So specifically today, we're going to go through a few of the cases where these patients would benefit from ortho treatment. So the first concept we're going to go over today is tooth elongation. Okay, let's take a look at the first slide here. Take a look at the red circle. So that tooth is a little bit longer than the rest of the patient's other teeth. Why does this occur? Well, that's because of tooth elongation. There's no opposing tooth to hit it, so basically that tooth just grows longer and longer and longer. So if you take a look at the picture, it's a little bit longer than all of the patient's other natural tooth. So for a patient like this, there's going to be 3 options of how to treat that tooth. Number 1, go see an orthodontist. The ortho is going to basically push the teeth back into its correct position, and after that's done, we can go ahead and place the implant then. Number 2, we can basically trim off the portion of the tooth if it's not too much. So if it's just a little bit minor protruding, we can go shave it off and the patient will be fine. Third option, if we have to shave off a lot of the patient's tooth, then the patient's possibly going to need a crown on top of that, because if you shave off too much of the portion of the patient's tooth, there's not enough structure left to protect the remaining vital structure of the tooth. Okay, so 3 different options for someone like this. The patient in this case was in his early 20s, so he opted to basically get ortho done before having his implants placed. Okay, another case, similar option here. So take a look at the red circle. No opposing tooth on the opposite arch, so same thing. The tooth gets a little bit longer, so a little bit longer than all of their other natural tooth. Cases in this case, the patient opted not to get ortho. Patient became pregnant after the implants was placed, so dealing with the pregnancy and everything else, she didn't want to go through the hassles of having ortho. So in cases like this, we're going to shave off the portion of the tooth first. If there's too much, then we'll ultimately do a crown. But for this one, the patient opted not to have ortho treatment done. Okay. Another issue why ortho would be needed prior to implant placement is a spacing issue. There's either too much or not enough space to place the dental implant. So let's take a look at the x-rays here for this patient. So take a look at the portion where the patient is missing a tooth. Same patient, opposite side of her mouth. So in this case, quite the opposite. Patient has enough room for the implant, but not enough room to restore and place a crown. You can basically still squeeze a crown in there, but not optimal. Because in this case, the patient was going to get ortho done to treat her other side, she might as well treat this side as well. Basically create more space here, and ultimately we can get a better fitting crown to be placed. So the implant will be much better for her to restore, much better looking crown, basically more bite area as well. So for this patient, because she was in her early 20s, she would benefit from ortho treatment. Another reason patients should try considering ortho prior to implant placement is their teeth position. Let's take a look at the x-rays here. So if you see on the upper arch, the patient has a really bad cavity that basically ate a big portion of his tooth. So take a look at that red area right there. Patient needs to extract that tooth and have an dental implant placed. Let's take a look at this x-ray. Let's look at the patient's lower jaw. Although the patient's going to have implants placed in his upper jaw, if we take a look at his lower jaw, you see how a lot of his teeth, they're really crooked. So for this patient, he was always considering doing ortho. But for cases like this, we recommend finishing ortho before having the implants placed. And the reason for that is your natural teeth will shift over time. Teeth move all the time. So although they move very slowly, every 1, 2, 3 years that go by, teeth will shift. Implants, however, will not shift. Generally, whatever position we place the implant, they're going to stay in that position basically forever. So for a patient like this, it's better that they correct their bite, have a much better functioning bite prior to placing implants. And the reason we're going to show you that is if we take a look at the next slide. So for this patient, let's focus on the yellow circle. So the yellow circle, that was the implant that was placed 9 years ago. The next thing I want you to take a look at is the patient's natural teeth to the right of that. You see how basically the two teeth to the right of the implant, those have basically become a little bit longer, while the patient has a little bit of an overbite. So because of that, basically the teeth have shifted downwards. So 9 years ago, the teeth were in perfect alignment. 9 years later, his natural teeth are shifting. The implant has not moved. So therefore, if you have ortho done previously, continue wearing your retainers because your natural teeth can still shift over time. Implants will not move. Something for you guys to consider. So now let's move on to our final case. So basically, if you take a look at the x-ray here, you see the patient is in need of 2 implants on his upper arch. However, basically this patient has what they call underbite. So if you see the lower teeth, if you see from this angle, they protrude very forward. So if we place the implant, the patient would not actually be able to bite with it. So if he smiled, yes, he would look like he would have teeth. He wouldn't be missing any teeth, but he would have absolutely no bite function in terms of when he bites down, those implants or where we're trying to place the implants, they wouldn't hit anything. So for a patient like this, it's not recommended to do the implants prior to ortho because although it looks nice, if you can't bite with it, what's the point of having dental implants placed? So for this patient, we also referred him to go get ortho, and I believe currently the patient is in ortho treatment. So once they fix that bite, everything's in perfect alignments, then we're going to go ahead and place the implant placement. So our final slide for today is something I just want to focus on. Anytime, it's generally not recommended to have implants done on your lower front teeth. And the reason for that is your lower front teeth essentially dictates where all the teeth movement in your entire mouth. If your lower front teeth is very stable, basically your teeth will not move. If your lower front teeth is unstable, in this case, if you take a look at the patient here, she's missing her lower teeth. This is going to be a nightmare in terms of teeth shifting. So keep this in mind. Anytime you can save lower front teeth, go ahead and save them. Try not to have implants placed unless it's absolutely necessary. So if you're missing a tooth or the tooth has been taken out, then consider dental implants. But if your option is a root canal, a core buildup, and having a crown placed, go with that option first. Try not to have dental implants placed on your lower front teeth. Okay, that's going to be it for this video. So feel free to email us any questions you have on dental implants at help@cerritosimplant.com. However, for specific orthodontic question, don't email us. We don't do ortho in the office, so we're very complicated, complex ortho questions, we wouldn't be able to answer it. Okay, until next time, this is James at Cerritos Dental Implant Center. I'll see you on the next video.